I trust you all enjoyed your breakfast and had a chance to network. My name is Madiba Chaudhry, and I am the project manager for Health Equity and Promotion at CASSA, and I will also be your host today. And this year also marks a significant milestone as it is our first in-person annual Health Equity Summit since 2019. So I want to extend a warm and heartfelt welcome to each and every one of you. And we're deeply grateful for your participation at CASSA's 12th Annual Health Equity Summit. And this year our theme is a South Asian Youth Perspective on Health Equity and Inclusion. And to kick off the event, it's essential that we acknowledge the land that we are on. So at this moment, I'd like to invite Samia Hassan, our Executive Director, to lead us in the land acknowledgement.
Good morning, everyone. Thank you so much for being here. And I apologize if I didn't get to introduce myself to everyone in the room, but I'm here. I'll be in a mask for most of the day. I'm just going through something for the last few weeks here. But I appreciate everybody being here on a Tuesday morning to learn about health equities and inequities. So we're grateful for the opportunity to gather on this land and thank the generations of Indigenous people who have taken care of this land long before other nation groups came. We acknowledge that the work of CASSA takes place on traditional Indigenous territories of the Huron-Wendat, the Haudenosaunee, and the territory of the Mississaugas of the Credit. This territory is part of the Dish with One Spoon Treaty, an agreement between the Anishinaabe, the Haudenosaunee, and the allied nations to share and care for the resources around the Great Lakes. This territory is also covered by the Upper Canada Treaties. Today, see Takaranto, the traditional Mohawk name of this area called Toronto, which means trees in the water and its surrounding areas are still home to Indigenous people. And we are grateful to have the opportunity to work, meet, and play on this territory as settlers. We wish to express gratitude to Mother Earth for the resources we are using and honor all First Nation, Métis, and Inuit people who have been living on this land since time immemorial. This recognition of contributions and historic importance of Indigenous people must also be clearly and overtly connected to our collective commitment to make the promise and the challenge of truth and reconciliation real in our communities. As today's session focuses on health equity, it is particularly important for us to recognize the severity of health inequities in Indigenous communities. We stand in solidarity with Indigenous communities in calls to all levels of government to develop Indigenous-led health policies and practices that are informed by Indigenous healing practices. We must hold our governments and health institutions accountable and advocate for increasing equitable access to health care for Indigenous people. We also need to continuously educate ourselves about the colonial history of this country and understand how the wrongdoings of the past still impact the health and well-being of Indigenous communities today. While we are searching for this truth, we must also recognize that those seeking justice must always stand with the oppressed, the colonized, the occupied, and the victims of genocide. As I say this land acknowledgement today, I also wanted to take a moment of silence to pay respect to those innocent lives lost in Indigenous communities here in Canada, to those children buried in residential schools, and to those thousands of innocent men, women, and children and babies being slain in other parts of the world. Right now, it feels like the world is on fire. And it feels like it's so distant from us, but yet so close to home. As you take in the silence in this room, I want you to imagine what you would have done if you were alive to witness the ethnic cleansing of Indigenous communities. Thank you for this moment of silence. I hope the actions that you have imagined during the silence inspires you to seek the truth and justice today. Throughout the event today, we will ensure to give you lots of space for healing. We have encouraged everyone at this session to actively seek the truth, justice, and take action. Now with that, I would like to introduce Bharat Saini. Bharat is going to initiate today's proceedings, and it's my honor to introduce Bharat, the chair of CASSA's Board of Directors. Bharat Saini is the inaugural Director of Equity, Diversity, and Inclusion with the Faculty of Arts and Science at the University of Toronto. Bharat is responsible for developing and implementing strategic initiatives aimed at advancing EDI within the learning and working environments. He provides strategic guidance and advice to the deans, executive team on matters of policy interpretation and practice concerning a range of areas including accessibility, diversity, equity, and inclusion, freedom of speech, and freedom of expression. Bharat has been working in the post-secondary sector for more than a decade. Prior to joining UFT, he served as the Manager of Human Rights, Equity, and Inclusion with the Center of Human Rights, Equity, and Inclusion at Humber College. He has held roles with Osgoode Professional Development at Osgoode Hall Law School, OCAD University, York University. Bharat strongly believes in the importance of community work and engagement. Since 2008, he has had the privilege to serve on the board of the Canadian Association for the Prevention of Discrimination and Harassment in Higher Education. In addition, since 2020, he has served on CASSA's board, chaired the Human Resources Committee, and became the chair of the board in 2022. Bharat is committed to driving transformational systemic change in order to promote anti-racism, equity, inclusion, while fostering a sense of belonging for all. Please welcome Bharat.
Good morning, everyone, and welcome. Samia, thank you so much for the introduction and the very meaningful land acknowledgement. It's something that we talk about at UFT quite a bit about, really moving away from just reading a land acknowledgement and really thinking about and reflecting on the words, but also our actions as we move forward towards reconciliation. It's so great to be here today. Thank you everyone for being here and participating in our 12th annual Health Equity Summit. Before I continue though, I do want to take a moment to express my gratitude to Samia, Madiba, the whole CASSA team that's surrounded throughout here, and I know some of the staff are just outside there, as well as our partners, Centennial College and United Way of Greater Toronto, for all the efforts that have gone into organizing this year's summit. Thank you so much. And a quick also thank you to the event staff that are helping with today's event for everything to be as smooth as possible. Thank you. As Samia mentioned, my name is Bharat Saini, and I have the privilege to serve as the chair of the board of directors. For folks that are new to the Council of Agencies Serving South Asians, or as we say, CASSA, and attending one of our events for the first time, I'll provide a brief intro to our organization. CASSA is a not-for-profit social justice umbrella organization representing over 120 member agencies. CASSA aims to build the capacity of the South Asian communities to be able to participate fully in political, economic, cultural, and the social fabric of Canadian society. As an organization that's focused on advocacy, training, capacity building, as well as policy change, our focus is not on frontline services. Rather, our focus is on influencing systemic, strategic, and policy level changes to improve outcomes and the overall well-being of South Asian communities in Ontario. Our current strategic directions, and there are several, so I'm going to list them because I think it's important for us to go through them very quickly, include enhancing health equity, supporting immigration and settlement, economic empowerment, advancing anti-racism and anti-oppression work, gender equity and empowerment, as well as combating online hate crimes, and hate speech. And a quick plug, if you haven't had a chance, I would encourage you to download our app that's focused on this last area around online hate crimes, and hate speech. and it's a wonderful app. I've heard great reviews so far on it. We also partner with our member agencies and social justice organizations across the province to work towards our strategic directions. I'm truly delighted that this is CASSA's 12th Annual Health Equity Summit. We were virtual for the last few years, so it's wonderful that we're able to meet again in person. CASSA's Annual Health Equity Summits has been central to the work we have been doing on health equity for well over a decade now. The objective of these summits is to enable, as well as provide a forum for South Asian and other racialized communities to discuss how we can work together to influence strategic systemic changes which will improve the health outcomes for our communities. CASSA has covered quite a diverse range of pressing and important health topics over the years, ranging from chronic diseases, mental health and addiction, sexual health, social determinants of health, and policy making, and COVID-19 emergency care and response. This year, the summit will center on South Asian youth perspectives on health equity and inclusion. Deepest gratitude to our colleagues joining us today who will be sharing critical insights and leading us through several discussions on these related topics. We know that this type of transformational systemic change work, it takes time, it takes community, and it takes resources. Again, I thank all member agencies and partner social justice organizations for their ongoing commitment and support to advance this meaningful change. I look forward to an engaging day with everyone here. And now I'll pass the mic back to Madiba, who will introduce our esteemed partners. Madiba, thank you.
Thank you, Bharat, for the introduction of CASSA and the summit. So without further ado, let me introduce our first partner, Nation Chung. Nation will be speaking on behalf of United Way Greater Toronto's South Asian Community Advisory Committee, a group whose insights and expertise in health equity have been invaluable throughout the planning process. Nation Chung is the Vice President for Community Opportunities and Mobilization at United Way Greater Toronto. For over 20 years, Nation has dedicated his professional and personal time to community development strategies. He started on the front lines supporting individuals impacted by chronic mental health, substance dependency, and inadequate housing. Later, his work focused on positive youth development for young people across the GTA, including the influential Youth Challenge Fund and United Way's Youth Success Strategy. Known for his integrity and ability to bridge diverse perspectives, he is a respected organizational leader, strategic partner, community animator, artist, and teacher. As United Way's VP, he works closely with public and private sector partners and community service agencies to collectively plan and build more inclusive communities, including the implementation of local economic strategies. Nation oversees United Way's research, public policy and public affairs strategies, strategic initiatives, and United Way's reconciliation and equity action plan. Please welcome to the stage, Nation.
Good morning. How's everyone? The subject of mental health is close to home. Leading up to Christmas of last year, I met with my two older children and they said, we feel like our family's fractured. We're not connecting as much. The pandemic has had such an impact on us. We weren't allowed to go into people's house freely. We weren't allowed to drop in. And it's really frayed our sense of connection. This was a week and a half before Christmas. The next Monday, I went to work and I got a call from my younger brother. He was in tears. His eldest son, my nephew, took his life. It's devastating. The data is clear. Young people across North America are feeling increasingly isolated. Their sense of connection and hope to what the future has to offer at best is confusing, at worst it's hopeless. The world is on fire. You need not look very far. The world is literally on fire. The job market is shifting rapidly. AI is shifting everything, and young people are like, what is going on? There is no clear, easy pathway for me. And I was waiting to be an adult. I can't even afford an apartment anymore. This is the truth of our young people. Add to that, you are now entering a new country with a new language. Who knows what gymnastics, dance, cost it took you to even get on the plane, to get here. And there's a system that is supposed to support you that has failed you. Samia, on behalf of the United Way, thank you for always being an incredible partner. And thank you always for reminding me personally and our community the importance of truth-telling. Many thanks to colleagues, Jyoti, Ilmana, welcome back. Fareen, Kiran, for leading the South Asian Advisory Committee. The work that United Way does gets lots of accolades. The work that United Way does well is only done so in partnership with community. There is no other way. There is no other way to have impact with community unless you center the voices of those folks who are most impacted, who are living the day-to-day realities of what we set out to do in our mission. You can ask the international student living in Brampton, rent is going up faster than any other city in Canada. What's holding back their health and well-being? Finding a place to live, feeding yourself when you have so little left after paying rent, not to mention tuition, trying to study and advance your career when your private space at home is a mattress on the basement floor in an overcrowded house. This is the living situation that 25-year-old Ashish Sharma, an international student living in a rooming house in Scarborough, recently shared in the news. In his own words, the cost of living and rent shot up too quick to be able to manage. I starve myself of healthy food and meat products because I cannot afford it after paying my monthly rent. I only survive on lentils and noodles. This is not what I expected. My health has deteriorated in the last 2 years greatly. As a young person struggling with mental health, and they may very well be one of the 86% of youth aged 12 to 25 in Ontario who reported worsening mental health in 2021, according to a study published this year. How they are going to cope when facing the added burden and stigma of trying to find culturally relevant mental health services that have a baseline understanding of what it's like to be you. We've committed to supporting this leadership with an annual investment of $2.5 million in South Asian communities across the GTA. Some of the programs include, in addition to CASSA, South Asian Autism Awareness Center in Scarborough, Polycultural Immigrant and Community Services, and the innovation we saw during COVID, where mainstream public health measures weren't working for Peel's South Asian community. So 2 United Way funded agencies, including Indus and Punjabi Community Health Service, supported with flexible funding, deployed community health ambassadors, a model that was so successful, the Ministry of Health made it central in its hotspots strategy. All of this work guided by nothing about us without us principle that United Way has embedded in our own reconciliation and equity action plan. I look forward to our conversations, and to the insights, innovation that will ensure that more of our young people have the safety net that they need going forward. Thank you.
Thank you, Nation, for sharing such a personal story and a powerful message. And we hope that this summit will be a small step towards the systemic change that we want to see. Next, I would like to introduce Veronica Henry, who will be speaking on behalf of Centennial College. Centennial College has been equally instrumental in this collaborative efforts. Veronica Henry is the Dean of the School of Community and Health Studies at Centennial College. Veronica has 12 years of management and academic leadership experience, overlapping with her practice as a criminal defense lawyer. Veronica is a caring and collaborative leader who is a true advocate and fighter inside and outside the courtroom. Veronica is currently co-chair of Centennial's Anti-Black Racism Task Force and has sat on a number of committees to improve outcomes for historically marginalized students, women's leadership, and anti-oppressive practice. Please welcome Veronica.
Thank you for the kind introduction, for having me here today. Good morning, guests, members of the Council of Agencies Serving South Asians, the South Asian Community Health Task Force, community partners, colleagues, students, and esteemed speakers. Welcome to Centennial College's Progress Campus. I'm delighted that you chose to host this crucial annual discussion on health equity here. Thank you, Samia, for starting us off in a good way with the land acknowledgement this morning. Centennial takes the position that land acknowledgements are needed to increase awareness of Indigenous presence and land rights in everyday life, and to recognize the history of colonialism and the need for positive change in settler colonial societies. It is essential and meaningful practice. All settlers, including those like myself who immigrated here, have a responsibility to consider what they mean. Centennial's land acknowledgement was gifted to us by the late Joseph Bob McQuabe, who held many positions at this college, including Indigenous Outreach Coordinator. In this space, each word has significant value, so thank you. I would like to commend CASSA, your sister agencies, and United Way for the courage to have this conversation, for the trust it takes to hold space for the analysis of healthcare in our country, and for the emotional labor of creating hope that we can and will do better to address the social determinants of health and health inequity, particularly here in Scarborough, where almost 73% of residents are racialized and 50% of residents are born outside Canada. I wanted to start by sharing with you what health equity looks like on a personal level and why discussions like this are so important to me. According to Public Health Ontario, health equity is created when individuals have the fair opportunity to reach their fullest potential, and it requires reducing unnecessary and avoidable differences that are unfair and unjust. When I took an informal poll of some of my close friends and family, none of them could come up with that exact definition, but they could all recall how the effects of health inequity show up in their daily lives. I'll spare you some of the most troubling stories and share my mother's example. When she became ill in August, she visited several healthcare providers, including the emergency unit at a local hospital. She felt no one trusted her description of the severity of her symptoms, and she was sent home each time, only to return to another emergency department after another week of feeling close to death. At that point, she had to be admitted to the hospital with pneumonia. While there, she requested that my sister bring her a few items of clothing. When her bag arrived, even in her state, she nearly had a fit. The items were clean, not tattered, no stains, they were age appropriate. However, because of her lived experience, they were not suitable for her to wear in a hospital while lying on a bed recovering from significant illness. She felt that if she was not the most presentable, even on her sick bed, it would impact the level of care she might receive because of assumptions about her race and gender, which would lead to assumptions about her income, her hygiene, education level, and her ability to feel pain. Having the correct clothing was armor for her against pervasive stereotypes that seep into the delivery of care and cause an unneeded level of stress for people already at heightened stress levels due to illness. For some people in this country, receiving good care feels more like a luxury when it should be a right. They are also coming to one that has experienced significant disparities in health outcomes. Reports from the CDC in Canada, the Guardian in Australia, the National Institute for Health in the United States all point to the fact that international students face increasing challenges with mental health and suicide, but there continues to be limited resources and understanding of the issues. In the words of Bono, and I never thought I'd quote Bono, but here I go. Where you live should not determine whether you live or die, whether it's here in this country or anywhere else in this world. This must and can change through the work you do today and through organizations like CASSA. I want you to know you are not alone in that work. Centennial College and the other anchor institutions in Scarborough, the Scarborough Health Network, the Toronto Zoo, and the University of Toronto Scarborough, are committed to improving health outcomes for those who live in this catchment area and in this country. Together, we operated the busiest vaccine clinic in the country during the pandemic, with Centennial students in the Community Service Worker program going door to door, offering information in several languages to residents. Last February, we participated in the Bridging the Equity Gap in the Eastern GTA discussion with UTSC's Partnership for Inclusive Health to explore health inequities within the region and start to define better pathways to improving the health and well-being of local communities with a focus on health as a human right. This coming February, UTSC, SHN, and Centennial will host another health equity conference featuring Dr. David Williams of Harvard to examine why we have seen so little progress despite so much awareness of the issues around health equity. Centennial also invests in initiatives to support housing for international students, tackling a significant social determinant of health, and the School of Community Health Studies is developing curriculum specifically on Indigenous health outcomes. Today's conversations are meaningful for Centennial College and the School of Community Health Studies. We are honored that CASSA members and sponsors chose to have that discussion here. Your vision to build diverse and inclusive communities in Canada, free from all forms of discrimination, racism, and hate, is one that Centennial fully supports for our students, for our community, and this country, but also for people like my mother and many like her who deserve access to health care, to be believed when they are sick, and to be free from the worry that they will not be treated with dignity when they receive care. Thank you for your work, and welcome to Centennial College.
Acting Executive Director at the Institute for Change Leaders. She believes that through collective action, we can make social change and build stronger communities, especially through the power of storytelling. She completed her master's degrees while working at ICL, focusing on issues related to refugee and immigration system, early education, early childhood education, mental health, anti-racism, gender-based violence, and more. She is also the facilitator with ICL and has completed a certificate for the trainer program through the Leading Change Network. And Reith holds a bachelor's degree in criminology and a master's degree in immigration and settlement studies at Toronto Metropolitan University. Please welcome Amrit.
Good morning. Oh, can you grab that on? Good morning.
Good morning.
Thank you. Thank you to CASSA. Thank you to all the folks that are in the room today. I gotta focus on the mic. And joining us to address the critical issue that affects not only the South Asian community, but many other racialized and marginalized communities, health inequity. It's an honor here to stand before you to discuss the pressing matters that not only demand our attention, our empathy, but our action. Let's see if this works. So I have a quote here for you from the President and CEO of the Canada Mortgage and Housing Corporation. I happened to hear her speak, and this quote stuck out to me quite a bit. Now more than ever, we see that the home is not just a place to live, but it's also a sanctuary, a place to feel safe, and everyone deserves that. Now, a sanctuary. When I was younger, oh, I'm going backwards. Haha, there we go. When I was younger, I grew up in a small little suburban home, cookie cutter house, 4 bedrooms, you know, cool little rose bush that I was standing in front of with my sandals and socks. Forgive the fashion faux pas, it was the 90s. It was a quiet suburban street, you know, it looked fantastic and normal on the outside, but when you look on the inside, the home was not a sanctuary. I grew up with an alcoholic and abusive father. He was violent, and he took out a lot of his bitterness, his insecurities, his frustration out on my mother. And eventually that included not only him, but, her, but myself and my brother as well. It went on for many years, but eventually I was able to save up, you know, get the courage and the ability to move out, because traditionally we don't do that. You get married and then you move out. It took a long time, but I was able to do it. And in the back of my mind, I always wondered what would happen to my mother and my brother who were still left behind. Now, we fast forward to 2020, and it's the height of the pandemic. I'm in my master's still doing I was also a TA, so I'm there sitting, marking papers at 10 o'clock at night, as we do, and I got a phone call from my mother, panicked, crying. My brother and father had gone into a fight. It started off as an argument, it turned physical. Now you see, my brother had stayed home and he had been living in the chaos, and he continued to live in the chaos, which resulted in him to follow my father's footsteps and turn to alcohol to cope with the issues that he was going with. He couldn't afford to move out, he couldn't afford to get the mental health support that he needed, he didn't have access to it at the time. And now, add on top of that, it's 2020, it's COVID, it's the height of the pandemic, and he works in a hospital. So every single day, he is seeing chaos around him. He is seeing people who are literally dying in front of him in this hospital every single day. Naturally, he needed something to turn to. And so his choice was alcohol to try and numb that pain. Now, this night, after a long day, you know, of working and being tired and exhausted, he had a little bit too much to drink. He got into an argument with my father, my mother tried to step in, my father, being who my father is, pushed her out of the way. Now my brother, having lived through what he lived through, seeing the abuse on a daily basis, he saw that the one person that he truly cared for in that house be pushed aside. So naturally, he reacted. And a fight ensued, and I ended up on a FaceTime call with a police officer. Now, in this time, to say the least, I was stunned. I was absolutely stunned at what happened. You see, I'm the eldest sibling, I'm the eldest daughter, I'm the one that bears the responsibility in the household, I am the protector. And I've always played that role. And so in this moment, I felt like, okay, normally I'm the one who stands up, pushes back, is the protector, is the person to, you know, support my mother and my brother and protect them from the things that this man does. But here, I'm far away. I can't do anything really aside from talk to a cop on the phone. Also, just in case you haven't seen or figured it out, I've always been a rebellious child. If you look at the picture where I'm in the lenga, I'm literally making fun of my aunt as she is dancing. I've always been known to be that child that will do the things that I'm not supposed to be doing, saying the things I'm not supposed to say. And so I was labeled the rebellious one. Here I am, the rebellious child, who just can't do anything because I'm so far away. In this case, I had, you know, grown up seeing my father make a fool of himself at weddings, functions, all of these things, watched my mother go through and do an apology tour afterwards for his behavior. And with all of this, I would always urge her to say, you know, to leave. And not only get the respect for herself, but also protect us as her children. But with all this said, I would get that one classic line. Oh, what would people say? Punjabi, Roki ki kenge, you know? That is what I would consistently get. What will the community think? What will people say about, you know, if I were to leave him? How do I leave him? I don't have any money. I can't take my 2 children and run away. What will my family say? I grew up hearing this. As many of you have probably grown up hearing this. I saw some nodding heads through the room. And with this, I, you know, grew up hearing this, tried to challenge it as much as I could, but seeing that my brother had then started following my father's footsteps, that hurt. It was sad, it was frustrating to see, and, you know, as much as I could try and speak up, I would get hit by that line. What will people say? What will people think? Even though I had to work so hard to get out, and I wanted the same for them. You see, I lived at home until about 24, give or take. And then I had gotten out. I was able to, you know, use school as a safe place, would always be doing all the activities, going around, every sport possibly imaginable to make sure I wasn't able to go home. Education was my passport to life, as it is for many of us in this room, and has been for many of us in this room. You know, if I got a good job, if I worked really hard, I can go, if I study really hard, I can get a good job, and I can go, and I can get out of this household that I'm living in. Before getting out of there, you know, in my last, I want to say 10 years of living in that house, by the time I hit 13, I went from little baby girl who wants to make fun of her auntie and, you know, going through the abuse to one day finding my courage and actually speaking up. There was one day, I don't even know how it happened or what happened. I genuinely don't remember. I've had a couple of concussions since. That probably made my memory go away. But there was one day where I was able to find the courage. I was able to finally stand up and realize that I had a voice, and you sure as hell would believe that I'm going to use it. I don't have to stay at home. I don't have to, you know, be the traditional girl that my father wanted to be. I can use my voice, speak up, say a thing, talk back, push back, advocate for myself, advocate for others that are like me. I have a voice. And so I started to live my life, moved out, got my own space, and I finally found my sanctuary. I was able to breathe. And this was at the beginning of 2020. I was out of the darkness, I was out of the negativity, I was finally able to find this space to work on myself and actually heal. I saw the hope, and I saw what the other side could be like. Now, I wanted my brother and my mother to have the same thing. So on this night of the event that happened in 2020, I got my brother a hotel. I was like, you know what, here, stay at a hotel, get out of the space, and I urged my mother to also leave with her, with him. Pack your bags, stay with them, you know, do what you need. This is your one avenue out. This is the one thing I can do and I can afford right now. She didn't take me up on that offer. She stayed at home, same thing with my brother. They both stayed, and neither one of them left. Since then, I know they have been advocating and fighting as much as they possibly can within the household. I've taught my mother very well how to be sassy and stand up to this man, even though she can't afford to leave. You know, she can't afford to move out. There's, let alone trying to break the cycle of abuse. There's, you know, no hope. And that obviously has taken it took a pretty big hit on my mental health. Seeing that I was able to get out, but my mother and my own brother can't. That definitely impacted my mental health, as you can imagine. I started to lose a little bit of that hope, a little bit of that fear started to come into me, and because I didn't know what was going to happen to them. You know, there was that uncertainty of what would happen to them if they aren't able to get out. I started to lose this fighting battle. I got tired of fighting, realistically. So I had a choice to make. I could either keep going down this line and probably fall into a deep depression, or I can choose to get help. Now, I had a friend of mine, a good friend of mine, Angelique, who happened to know someone in the TMU counseling office. I was like, here, go talk to the TMU counseling office. They will help you. You'll be able to get that help and support that you need. So that became the first logical step. Now, I had finally hit university. I had access to benefits and things outside of my mom's benefits package, which meant that I could actually go and get mental health without my mom knowing. As many of us folks in this room can have maybe felt, there's the stigma behind mental health and having mental health issues. I fear that stigma for sure. I had that fear and that scaredness of, one, talking to a complete stranger about the things that are very deep in here to me, but two, what are other people going to think about it? That same thing of, that same stigma, all of that was just in the back of my head. But then there's also the other piece where mental health is really not a thing in a lot of South Asian communities. It's not something that's accepted. I'd always been grown up hearing, it's just in your head. Don't worry, you'll be fine. When you get married, when you grow up, when you get out of the house, you'll be fine. Instead of getting the support that I needed, I would get torn down for even trying to share what was happening with my close friends and my family. Or there was the other piece where it's, if I tried to speak out, I would be told, no, don't do that. Be grateful that you have something here in Toronto, in Canada, in Markham. You have a home. You're not starving like children in the rest of the world. All of these pieces, all of these things were coming at me at once, and it got to the point where I was so stressed that I had panic attacks. So again, I had a choice to make, where I finally went to the TMU counseling office. I had the courage, I was able to do it, I was able to go, I had the financial means to finally do it after all this time, and I'm hit with a 3-month waiting list. Take that in. Fight all these years, 24 years of my life, fighting for ages, fighting my family, fighting with other people in the world, finally finding that courage and that hope, and yes, being like, yes, I'm going to take charge of my life again, I'm going to try and do a thing, and I'm hit with a 3-month wait list. The only way I would see a counselor is if I was going to commit some sort of harm to myself. How bizarre is that? How wild is that? And I can only imagine how long that wait list is now. This would have been 2017, 2018. Wild. So once again, I had another choice to make. I could either continue going down this path and probably fail at my master's and figure out life from there, or I could turn what ended up being anger because I wanted to fight for this little girl, this kid, who had been fighting all of her life to try and do something and try to make something out of herself. And so, what did I do? I continued to work my butt off. Because I wasn't going to stop now. I wasn't about to lose this fight. I've been working my way through, and I wanted to also fight for other people who are like this little child. There are so many folks, not only in this room, there are folks that you know, there might be like your nephews and nieces or your cousins or your little ones that are going through the same thing. So, it was a long fight, but eventually, at TMU at least, we were able to win a little something, where a lot of our students came together, we organized, we were able to amplify our voices, we got a couple of petitions going, and eventually led to a referendum. And so we had a school-wide vote. And the school-wide vote, we voted yes to getting better, to making the university get better mental health care and access to our students. So what does that look like? It means that we were getting better quality mental health services, spaces, physical well-being, like looking at the physical well-being, getting access to more counselors, mental health support officers, nurses, anything that you can get to make sure that the students are getting the type of culturally sensitive mental health supports that they needed in a way that makes sense for them. So, how did we do that? It started off with a handful of small students. It was me, who got angry, and other students who were also angry with what was happening at the university, and we started to share our stories. We decided that, you know what, instead of reacting with fear to the things that are happening to us, we're going to take our voices, we're going to be those youth catalysts for change, amplify our voices, and respond with agency. Because you know what? We know that in this world there are stark health disparities that are here that result in an unequal distribution of health resources, opportunities, and outcomes. And a lot of it happens in marginalized communities like South Asian communities. We know that it's because of systemic factors. Look at the race, the ethnicity, the background, the socioeconomic pieces, the access to healthcare. If you don't have insurance, how are you going to get half the things that you need, including a mental health provider, someone who's a psychiatrist, a therapist, any of that. We all know this. But why do they persist? We know this is a complex question, and there's a complex answer to it. And a lot of it comes down to the access to the healthcare that we need. We know that because of economic issues, there are issues that are, that we face where we have barriers that hinder our ability to access these quality healthcare services. And this could be, again, insurance, culturally insensitive healthcare services that we get. You name it, there's all these issues. A key thing, look at COVID. When COVID was hitting my mother, her English, it's strong, but not that strong. And we had to honestly go ahead and try and explain to my mother and many of my aunts and uncles what this whole COVID thing is, why we need to get a vaccine, why are all these things happening, how do we get them to access them, how do we make sure that they're able to understand what is happening to them. With that, we know that these social determinants play a huge role, a significant role. Your education, your employment, your housing, your access to healthy food, all of these pieces, when they are compromised, it has an impact on one's overall health. We can see that there are many issues, there are so many disparities, and there are so many barriers to health equity. You've probably asked, how in the heck do we address this? How do we do anything to fix the problem that is at hand? How do we go from, hold on. Aha. The slides got mixed up a little bit, I think, when it downloaded. So how do we go from our hopelessness to fear? Going from the hopelessness, the despair, to fear, from the fear to getting something done. How do we take action? How do we move from being stagnant to being motivated? From that inertia, wanting to do nothing, to an urgency, like, okay, we need to work now. From apathy, like, okay, I don't feel like I can do much right now, to using that fuel as anger, as fire, that passion. How do you move from fear to hope? From that sense of isolation, where I know that we have heard from one of our speakers that a lot of youth feel isolated. How do we go from isolation to solidarity? And then from self-doubt to YCMAD. Does anyone want to guess what the heck that means? Speak up. This is an interactive keynote. YCMAD. What do you think it means? I hear something here. Anything. Yeah.
You can make a decision.
Almost close. You can make a difference. From one person of self-doubt, because honestly for me, even just knowing my own story, I was like, well, how am I going to do anything at this university, this huge university? Finding my people, I was able to make a difference. And a big part of it is through storytelling, narratives. You just heard my story, and this allowed me to, communicate with you what are my core values, what are the things that motivate me to make the choices that I'm making. It's through shared experience or values of our core values that we're able to engage with others. We're able to motivate others to take action with us and find the courage to also take risks, because this is a pretty risky thing when you want to share your story in front of people, including in front of the 80 to 100 of you that are here. It can be scary, but you go from that self-doubt to looking at how we can make a difference, and you can motivate yourself and also motivate others to do the big scary thing. It's, like for example, with the TMU example that I had, I could have given, the facts, the figures, all of these big things the entire time. But it wasn't until I connected from heart to heart that anything was able to be done. It's all about starting with the heart first, we'll go with the head with the facts and figures, and then going to the hands where you're taking action together. It was a small win, but it started with a story. And as many different organizations and organizing work does, it starts with that narrative. Once you start sharing your stories, you get one step closer to achieving your goal, including health equity. Of course, it's not going to be easy. It's going to be hard, and it's going to take a fight for yourself, a fight for others that for the people that are around you. a fight for people that you know that are not getting the support that they need. And it's all about advocating for the issues that matter to you. And you can do that by sharing your story and taking action. Now, I'll go back to the other one. Aha. How do you do that? There's a few different versions of campaigns. We have the AIR campaign, which is keep it simple, stupid. It's repetitive means, it is our social media, it's here, do this thing, sign a petition, do a whole thing. You have the inside. Once you're actually on the inside, once you're in an organization, you look at who are my people, who are my allies, how do I do this in a timely manner? We get to the outside. How big is the we? How can we get our we voice heard? The biggest part, I think, is what I call the ground game. And the ground game, you're looking at who are my people, what's the problem that we're trying to solve together, what is our goal? You're going to have more than one goal. You can have more than one organizing statement throughout your session. Then here's our fun part. What is my story? What's leading me to take action? What is our story as a collective? How do we use our story to then recruit others to join us in our efforts? Who has the power to make the change that we want to make? What's our strategy? How do we take this and turn this into an action plan? Around this, that key piece is honestly the story. This is what connects you not only to the cause itself, but to the others that are going to be joining you. Through stories, you can get others to act with you so that you're not alone working towards your goal. Sometimes when you're doing something and you're trying to advocate for things, it can feel pretty lonely. Like it's just you who's going through the issues. But no, we're not alone. Here's Marsha Vance, who is a lovely human being and one of someone that I look up to quite a lot. This is one of his favorite quotes. It's from Rabbi Hillel. If I am not for myself, who will be for me? When I am for myself alone, what am I? If not now, when? Here, with Rabbi Hillel's powerful words, you see that if you stand for yourself first, that's an insufficient first step. You have to also construct the community with whom you're speaking to. You need to figure out who are the other people that are going to be acting with you and why they must act now. If not now, when? We've seen all the health disparities. We've seen all the issues that are happening in our community. If we don't act now and be the enactors of change now, what the heck are we going to do? The questions of what am I called to do? What is my community called to do? And what are we called to do right now? Are three key pieces that I want you to think about when you're going through the sessions today and trying to advocate for health equity. So, why the heck do we tell stories? As humans, we are naturally hardwired to tell stories. When we were young, our parents often told us stories, and now many of us probably tell our kids stories. Not for me, only my nephews and nieces, not ready to be a mother yet, but I tell them stories. We grow up hearing these stories and then we repeat them. Each of us has a story to tell, whether you think you do or not. Because if we didn't, there wouldn't be a world that needs changing. We wouldn't be advocating for anything. We each have stories of hope, or we wouldn't be thinking that there's anything to change. Now, I'm going to do another audience situation. What's something that's memorable when you hear a story? What makes a story memorable for you guys? Feel free to shout out.
When I can relate that with myself.
So it's relatable. Okay. What else? When you hear a story, what else is memorable in a story that you hear?
Authenticity.
Authenticity. Okay. What else?
Human interest as well.
Sorry?
Human interest.
Human interest. Okay. Anything else? What else do we hear what's interesting and memorable when you hear a story?
Emotions.
Emotions. Okay. What else? This is very fun. Good going. Anything. Go with this side. When you hear a story, what makes it memorable for you? Do you think?
The childhood, or their childhood.
Your childhood. Okay. So something that you remember from your past.
Learning.
Sorry?
Learning.
Learning. A lesson. Yep.
Breakthrough.
A breakthrough. That aha moment that everyone has. So there's a lot of things that you can learn from stories, and that make the stories memorable. So stories teach us morals, they teach us the values, we have the lessons, and we learn how to make choices. How many of you in here remember the story of the tortoise and the hare? Anyone? Anyone? Okay, I see if you can't sing with this. For the version that I remember of the tortoise and the hare is, we have this little hare, and he is a sassy little bunny, who is like, making fun of the tortoise for being really, really slow. This tortoise says, all right, cool, let's challenge you to a race. And the hare's like, fine, because I know I'm gonna win that race anyways. So they go off, they run, and the hare is so ahead of himself, and he just beelines it, that he's like, you know what? Because I am who I am, I'm gonna be sassy and cocky, and I'm gonna sit down and I'm gonna take a nap. Because I know that even by taking a nap, I'm still gonna beat this tortoise. Lo and behold, the tortoise takes a nap. Sorry, no, the hare takes a nap. The tortoise, slow and steady, walks by this hare, and the hare wakes up from their nap and realizes, uh-oh, the tortoise is about to cross the finish line. So he beelines it, runs towards it, but alas, the tortoise still won and the hare lost. Does anyone remember what the key takeaway from that story was? It's a famous line. Slow and steady. Slow and steady wins the race. Now, what do we remember as the moral of that story? So aside from slow and steady wins the race, what's the other moral that it taught us as a kid?
Consistency.
Sorry?
Consistency.
Consistency. Slow and steady wins the race. What else?
Don't let others dictate what you can or cannot do.
Don't let others dictate what you can and cannot do. Exactly. Believe in yourself. Just because you have those sassy hairs in your life that tell you you can't do a thing, that doesn't mean that you can't do the thing. So, you might ask, okay, so here's the stories. We know the story of the tortoise and the hare, but how does that actually move us to action? That's where, here, stories help us feel. They remind us of the emotions they help us feel our emotions, and they remind us of our common values. Stories connect us emotionally, they reveal our core values, they allow us to learn to become better humans, they allow us to realize that we're not alone, they lift us from our fears and transform them into hope. They provide us the motivation to act. So here, with the values, you have the values that inspire the emotions and action through emotion. Our emotions inform us of what our values are, not only in ourselves, but in the world itself. The stories draw on our emotions and connect that action to help us feel what matters and not just tell us what matters. Because stories allow us to express our values in an abstract way, not in an abstract way, but in a lived experience method, it shows us that we have the power to move others. Now, there's 3 key pieces. You have our lovely little character here. When you're sharing stories, you'll see that there's a challenge, a choice, and an outcome. Every single plot begins with a lovely little character that has some sort of challenge that confronts them, and it's urgent, it needs to be done, it needs to be taken out, like action now, but they don't know what the heck to do. So they have a choice to make, and they gotta figure that out on their own. And then that yields an outcome. And through that outcome, you find a moral through that story. There's also 3 parts to your stories. There's story of self, which is inviting others to in a relationship with you. So this is your own call to leadership. Why do you care about the issues that you're caring about? You have the story of us, getting others to come into the journey with you, inviting your community to come in with you. And the story of now, which is inviting others to take action with you now. Not 10 years from now, not 2 weeks from now, not 2 hours from now, in this very moment. By combining your story of self, us, and now, you're able to find that common thread in the value that calls you to your mission, that is shared by your community, that demands why you must act now. Through your stories, you acknowledge that challenge, you're able to express that empathy, you can narrate the hope, and then you're able to enable someone else to make that choice with you. Through the story of the character, you're able to encourage others to learn about their own values. Look at their own challenges that they faced. What inspired them? And kind of provoke a new way of thinking to make choices in their own lives. You might ask, how does this play into advocacy? Where the heck does that come in? And that's where, here, the rules of story and organizing. You have the head, which is all the facts and figures, and the strategy, and how are you going to do things. You have the heart, which is the story, the motivation, why you're called to do the thing. And then you have the hands, which is the action and the now. Head, heart, Without the heart, you can't have the hands come out. So without the empathy that you have and the stories that touch other people's hearts and sharing the core value, you can't move. Without empathy, you don't have the courage to move. You might ask, what does courage have to play with this, or what does that have to do with anything? And what does courage have to do with empathy? Well, it's a courageous act to withhold judgment temporarily, to park our fear, to reach out and allow ourselves to be vulnerable. It takes courage to do something like sharing your story, to believe the goodness that each person has, and to encourage others to do their best. So we know that, it's not all doom and gloom, even though it might be gloomy outside today, where hopefully the sun will come out. There are ways to combat the things that you're trying to do and the health disparities. By sharing your story, you can also call for a collective action. You are able to have a few different actions that you can call for. So, for example, a key piece, we're at Centennial, education, outreach. That is something that you can call. We can call to invest in health, education, and outreach programs that are for marginalized communities, that are for the South Asian communities. We can help them make an informed decision about their health. Another thing, the mental health and stigma side of things that we all have some sort of information about. We can, we know that mental health remains a stigmatized issue in our communities, and that stigma attached to mental health is a significant barrier to getting people to seek that help that they do need. By amplifying South Asian voices in this healthcare discourse, we can work to reducing the stigma. We can promote greater awareness. We can get that acceptance of mental health and address these issues that are in our communities. Advocacy, advocating for policy change. By advocating for fair policies, we can dismantle that systemic barrier. We can create a healthcare system that truly serves everybody. Community engagement. There are many groups that are in this room today. There are many people that are here today that you can communicate with and engage with. Engage with your community leaders. Go find your MPP, your MP, your city councilor. They are leaders in your community and they work for you. By sharing your story, you can and putting yourself in there, you can be that person to design and implement some of these health programs that will have better successful outcomes. The other key piece, empowering other South Asian leaders and community members, and youth especially. By amplifying our voices, it means that we can do more than just addressing the healthcare disparities. It also involves getting folks into the healthcare system, into the research, into the policy-making roles. You and your unique insights and experiences can contribute significantly to shaping the policy that we see, and that we need to address our communities. There are a lot of actions that we can take together to address the issues that we do face on a daily basis. We just need the courage to do it, the hope. Imagine riding a bike. Sometimes we fall off our bike every now and again, and we can decide to, kick it because I fell, and I can, decide to never get back on the bike again. Or you can get up, get back on the bike, and keep going. With our commitment to justice, equality, we know that a more just, fair, and equitable world can benefit us all. We can build that fair and just society. It'll take some time. We'll definitely fall off our bike every now and again, but we're gonna get up, brush off our knees, and continue riding that bike. Like I said, it takes courage to show empathy, to tell your story, to empower others. It can be scary to go through. The trick is always picking a story that you're not overwhelmed with, something that is not an open wound. And just remember that building your relationships through your stories is what equals that power. There's a lovely little slide here. With the power, we're able to imagine what's possible, imagine how to lift people out of that fear, to be creative, to be empathetic, and there is hope out there, and the moment is now. I'm gonna skip through this story, the video, just for time, and I'll leave you with a poem. This is a poem by Richard Williams, and I'll read it out to you. So, all that we are is story. From the moment that we are born to the time we continue on our spirit journey, we're involved with the creation of the story of our time here. It is what we arrive with. It is all we leave behind. We are not the things we accumulate. We are not the things we deem important. We are story, all of us. What comes to matter then is the creation of the best possible story while we can, while you're here. You, me, us, together. When we can do that and take the time to share these stories with each other, we get bigger inside, we see each other, we recognize our kinship, and we change the world, one story at a time. Together, we can be the agents of change, the voices that demand equity, and the hands that extend to those who are in need of help. We can work tirelessly together to build a world where health disparities are nothing but a historical footnote. Where every individual, regardless of their background, can enjoy the fundamental rights of good health. So I say thank you, and let us embark on this journey to create a better, brighter, more equitable world for all. Let's get on that bike and keep going. If you need me, here we go.
Thank you, Maurice, for sharing such a vulnerable story at the beginning of the presentation and reminding us the importance of storytelling. So at this moment, as we wait for Centennial College's dedicated team to gear up for our lunch, we will have a brief roundtable discussion